السلام عليكم أعزائي الطلبة. Our lecture today in microbiology parasitology part about protozoa parasite Toxoplasma. Epicomplex and sporozoa. These parasites were characterized by the production of spore-like oocysts. Usually these oocysts are infectious stage containing sporozoite were known as sporozoa. They live intracellular inside the host, at least during part of their life cycle. In the taxonomy of Epicomplexia, Toxoplasma is classified into class Coccidia and family Sarcocystidia. I mean the phylum Epicomplexia and the class Coccidia and family Sarcocystidia and genus Toxoplasma and species Toxoplasma gondii. Toxoplasma, one of the most common parasites. There is only one species of Toxoplasma, Toxoplasma gondii. It's obligate intracellular single-cell parasite that can infect most animal and bird. It required more than one host. Field are the definitive host of Toxoplasma, while wild and domestic cat therefore act as reservoir for the infection. Human and other mammalian are intermediate host. I mean they have three types of the host: definitive, intermediate, and reservoir. There are three infectious stages of Toxoplasma gondii: tachyzoid, rapidly multiplying form; bradyszoid, tissue cyst form, they found in the tissue; and sporozoid that found in oocyst and oocyst. There are infectious stage of Toxoplasma gondii. Toxoplasma causes zoonotic disease, toxoplasmosis. Primary infection by this disease usually subclinical, but sometimes lead to chorioretinitis or may damage the fetus if acquired during pregnancy. These figures show the stage of Toxoplasma gondii. Oocyst, this stage containing inside him sporozoid. Tachyzoid is another stage of Toxoplasma. It's usually rapidly dividing form. It's found in acute phase and responsible of the clinical sign and symptom of Toxoplasma. When immune system overcome on the parasite, the tachyzoid convert to the bradyszoid. Bradyszoid slowly dividing form, found in chronic phase, in dominant stage in tissue. When immune system decline for many conditions such as disease or cancer or any other disease causes decline to the immune system, bradyszoid convert to the tachyzoid and tachyzoid began to invade tissue. Life cycle. The life cycle of Toxoplasma gondii has two phases: sexual and asexual. Sexual part occur only in the cat, and these cats are primary host for the parasite and produce oocyst. The asexual part, which occur in warm blood animal like human and other mammalian such as bird, and produce tachyzoid and eventually bradyszoid. Infection in human and other mammalian began by more than one route, either from ingestion of the cyst in undercooked meat of the infected mammalian, or feed on a drink or food contaminated with feces of infected cat that containing oocyst, or from contact with cat feces that containing oocyst. In the small intestine, the cyst rupture and sporozoid invade the gut wall, where they are ingested by macrophage and differentiated into rapidly multiplying trophozoid, tachyzoid that kill the cell and infect other cells. The tachyzoid is a stage responsible for tissue damage. Therefore, clinical signs depend on the number of the tachyzoid released, the ability of the host immune system to limit tachyzoid spread, and the organ damaged by the tachyzoid. The tachyzoid is responsible for the pathogenicity of Toxoplasma gondii. Usually, cell-mediated immunity limits spread of these tachyzoid and the parasite enter host cell in any organ, most commonly seen in the brain, skeletal muscle, and heart muscle, where they develop into cysts in which the parasite multiplies slowly. Dominant parasite which remain insist in the host tissue for years. This form called bradyzoid. Individual cysts may enclose hundreds of bradyzoid in thin cyst wall. These tissues are both important diagnostic feature and source of organism where tissue cysts break immunocompromised patient or where immunity decline in the patient. The cycle within the cat began with the ingestion of tissue cyst in raw meat, such as mice. Bradyzoid are released from the cyst in the small intestine, infect mucosal cell, and differentiated into male and female gametocytes. Then undergo sexual reproduction, and gametes fuse to form oocysts that excreted and pass in cat feces. The cycle is completed when soil contaminated with cat feces. Human infection usually occur from eating undercooked meat from animal that grazed in soil contaminated with infected cat feces, or from food or drink contaminated with cat feces containing oocysts, or from contact with cat feces. This figure shows the route of transmission of Toxoplasma gondii to the human and to the cat. The Toxoplasma can be transmitted to the human by direct way, either by handling of cat litter that containing or contaminated with cat feces containing oocysts and can transmit infection to the human. Also, a human can be infected by eating food such as vegetable contaminated with cat feces containing oocysts. Also, a human can be infected by indirect route when eating the meat of the intermediate host that infected with Toxoplasma and containing oocysts in his tissue. Also, a human, especially a pregnant woman, can transmit the infection to her baby, when tachyzoid is transmitted across the placenta to the fetus. Also, Toxoplasma gondii can be transmitted when a human transfer blood or organ to another human. Cats can be infected with Toxoplasma gondii when eating grassing contaminated with cat feces containing oocysts. Also can be infected by indirect way when eating the infected mice that containing oocysts in his tissue. This slide shows the life cycle of Toxoplasma gondii. Cat is the definitive host, and when sporulated oocysts pass in feces, the oocysts undergo sporulation. A human can be infected either by direct way when eating contaminated food and water with cat feces that containing oocysts, or can be infected by indirect way by when intermediate hosts such as sheep eating grasses contaminated with cat feces that containing oocysts. Then the oocysts convert to the cyst containing a bradyzoid in the tissue in the intermediate host, and the infection transmitted into the human when human ingest cyst in infective meat, raw or undercooked meat of intermediate host. Also, human pregnant women can be a transfer infection to her baby when tachyzoid is transmitted through placenta and can be infect baby. Cat also can be infected by ingested of raw meat of intermediate host such as mice that containing tissue cyst, and the cat become infected. This figure shows the sporulated oocyst of Toxoplasma gondii. The oocyst contain 2 sporocysts, each of which contain 4 sporozoids. Only cat will produce and pass Toxoplasma oocyst in his feces. This figure shows the tachyzoid stage of Toxoplasma gondii. This figure shows the brachyzoid stage of Toxoplasma. Tissue cyst of Toxoplasma filled with brachyzoid and tissue cyst contain brachyzoid that divided slowly, resulting in increases size of tissue cyst. Transmission. Cats are the main source of infection. Infectious oocysts are excreted by the cat for up to 2 weeks after initial infection and can survive in warm, moist soil for more than 1 year. Humans become infected via the following route. There are 3 routes for a transmission of the infection of Toxoplasma. First one, accidental ingestion of oocyst passed in cat feces via contaminated soil, water, or food, or handling of cat litter. 2. The ingestion of tissue cyst, brachyzoid, and tachyzoid with raw or undercooked meat of animal, lamb, pork, and beef. The third route, transplacental in transmission. It's occur almost when primary infection is acquired during pregnancy. Tachyzoid multiplying with the placenta and spread to the fetus, which it usually occur in rodent, man, cattle, sheep, pigs, but it's not usually in cat. Epidemiology. Toxoplasma gondii is capable of infecting virtually all known plant animals. Serological studies estimate that up to a third of the global population has been exposed to Toxoplasma gondii and may be chronically infected with these parasites. Although infection rate differ from country to other, however, in infant, each patient and other patient with weakened immunity, the infection can be serious and occasionally fatal illnesses. Toxoplasma. Clinical finding. Most primary infection in immunocompetent adults are asymptomatic, but some are or resemble these symptoms. Infectious mononucleosis, lymphadenitis is more common in human. Also, flu-like symptoms such as headache, fever, muscle pain can see also in infecting patient. The infection is generally self-limited and symptom usually resolves in a few months. Congenital infection can be result either abortion, stillbirth, or delivery of baby with encephalitis, chorioretinitis, or hepatosplenomegaly. Also causes fever, jaundice, intracranial calcification are also seen. Toxoplasma gondii also causes mental retardation, may develop in children months to years later after delivery. Congenital infection is the leading cause of blindness in children. When asked you what the parasite that causes congenital infection, you answer me that it's Toxoplasma gondii. Toxoplasmosis is one of the most severe complications in immunosuppressed individuals, including AIDS and a transplant recipient, leading to primarily to encephalitis. Laboratory diagnosis. Toxoplasma gondii can be detected by microscopic examination of tissue section that may reveal a presence of tachyzoid or brachyzoid. Gimza stain crescent shape trophozoid can be seen in acute infection, while cysts that containing bradyzoid may be seen in tissue with chronic infection. Second, Toxoplasma gondii can be detected serology for the antibody of the parasite. Immunosorbent assay or immunofluorescent assay can be detected IgM antibody during acute and congenital infection. High IgG antibody titer may be useful but could be of the mother. Increased IgM titer are related with recent infection. In contrast, IgG antibody appear by the 4th week after infection and may remain increased for years during subclinical infection. Toxoplasma gondii also can be detected by culturing this parasite in cell culture. Toxoplasma gondii also can be detected by molecular technique such as PCR polymerase chain reaction. Treatment of toxoplasmosis. A combination of sulfadiazine and pyrimethamine are widely used to treat toxoplasmosis in human. These drugs are used to treat congenital infection where their infection are asymptomatic or symptomatic. Also, it's treatment of choice for disseminated disease in immunocompromised patients. Although these drugs are beneficial if given during acute stage of the disease, during the active multiplication of the parasite, but it's not remove or eradicate the infection with this parasite. These drugs are believed to have little effect on bradyzoid stage. When patient allergic to the sulfa drug may be used another drug such as clindamycin, clarithromycin, and azithromycin.